Hi everyone, welcome to another Gypsy Nurse Live event. I'm Rachel, the online community manager, and today we are discussing something so important that we need to talk about it live today. I'm talking about putting yourself first. So a lot of you are putting your patients and your family first, but we want to talk about putting you first so you can continue to help your community. I have AMN Healthcare here to discuss available resources and subs you can take to make yourself a priority, whether that means taking time off between assignments, talking to a counselor, or traveling to a brand new destination, which we all don't mind doing, I don't think. They believe in helping you so you can continue to serve the communities you're a part of. So let's not wait any longer. We have Saundra and Russell and Avena. Thank you guys so much for coming on today.
We are so excited to be here. Thanks so much for bringing us back, Rachel. We love talking to the amazing Gypsy community, so we appreciate our partnership with you. We're very thrilled to talk about this incredibly important topic, which is self-care. And we are dubbing this summer Self-Care Summer. So we want to talk all about that great stuff. But thanks for the intro, Rachel.
Thank you.
Yeah. Well, before I jump in, I do want to introduce my awesome panel here, and I'll have them introduce themselves. So, Russell, I'll kick it over to you first to tell us who you are and what you're doing here.
Hi, Gypsy Nurse community. I hope everybody's doing well. Russell, I've been with the company for, gosh, it's about 3 years. I did take a little bit of an interim break, but I did re-boomerang, if you will, back in November. I'm a senior recruiter here, so it's been going great, and I love working with all of you nurses. You guys are amazing.
Love it. Thanks, Russell. And then we're thrilled to have actually one of our travel nurses. So, Miss Anne, would love to hear from you.
Hi, everyone. I'm Anne. I'm back. I am a NICU nurse. I've been with AMN for almost 3 years as well. So excited to be back. Thanks for having me.
We love having you. And I know the Gypsy community is probably going to have all kinds of good questions for you, Anne. So we welcome those. And then last but not least, Miss Avena.
Hey, everybody. Good morning, good afternoon, wherever you may be. I am Avena, Senior Placement Manager 2 for NurseChoice. I have been with the company for 7 years now, so definitely excited to be a part of the panel.
The time flies, doesn't it, Avena?
Especially when you're having fun, right, Saundra?
Absolutely. And my name is Saundra. If you've been on these with us before, you know that I am the Divisional Vice President for our nursing division for training. So everything that goes into our recruiters talking to you comes through me. So very excited to be here again with you and to just hear from the community. So before we jump in, you know that I can't start any of these without just first thanking our amazing travel community, our clinicians, nurses, sterile processors, surge techs, whoever you may be, just for all of your hard work, especially in the last 2 years, but really just always. So thank you for everything that you do. We are here for you and we want to support you. And just again, thrilled to talk about self-care and giving you the opportunity to care for yourself before you can care for anybody else. So without further ado, we'll jump right in. If you have been with us before, you know that we also have some fun giveaways. So the first giveaway that I'm going to throw in is actually the first 5 people who put a question in the chat. So first 5 people to enter a question in the chat will receive an AMN branded water bottle, a white noise machine, a travel planner, an at-home spa package. Anne wants it. She's excited about it. So she's asking if she could throw some questions in there. But first 5 questions in the chat. We'd love to hear from you, everything that you need to take care of yourself. So just to start us off, Russell, I'm going to come to you first. But we have a lot of, new travelers, maybe some seasoned travelers on the call with us today. What are some of the things that you think it's critical for our listeners to know, just even starting this travel journey?
Absolutely. Ask questions, let's start off by asking, what is it like getting into an assignment? What does that mean for you guys? Questions are always what's going to help you out, because at the end of the day, you got to figure out your time off. I mean, traveling, we're going to go travel places. We're going to experience moments and figuring things out. So logistics, figuring out what that is for a traveler, the do's and don'ts, getting acclimated. Ask those questions to your nurse manager. Figuring out what other travelers are like and jumping on these travel pages are extremely helpful. So Knowing that we have support groups and departments that can definitely identify some of those other questions for you as well.
I love that, Russell. And a couple of things that you said there that I'll just hit back on is that all of you are on this call. So doing a little bit of your research and knowing what you're stepping into, hearing from some of the different agencies that you have, but also who's there to support you. We are talking about self-care. So part of that self-care is just having a community of people that can help you when you need help. Avena, I know you were going to talk a little bit on this topic as well. So I'll come to you.
Of course. One of the things that I would like to say is that it's still a great time to travel. It's still a great market. Rates are still good. And there is a lot of jobs that are out there nationwide. Summertime rates, pre-pandemic, they weren't as high as they are right now. So you're still able to make some great money that's out there that you do as a staff nurse. There's some awesome locations. You can stay local in some places. So being flexible is just huge as a traveler. It gives you many more opportunities. So it is still a great time. And I have to put a plug in, winter rates are coming soon, Saundra. They're coming, they're opening. So just be ready, be ready.
It's crazy to hear about winter when I'm in Palm Desert, California. It's 97 degrees outside and I'm starting to hear about winter coming, but you're absolutely right. We're starting to see all of those winter needs trickle in. So a big part of what the recruiters are talking about with self-care is just having kind of that plan for yourself. So you know where you're headed, you kind of know what to expect. And Avena, I know you're going to talk to us a little bit more later on about the excitement of travel, but what you're probably starting to hear, and I'll come to you in just a second too, is that we're thankfully transitioning out of this kind of pandemic mentality of just craziness everywhere. And we're able to get back to the fun of being able to travel. So one of the great parts of being a travel nurse, and you can back me up on it. If it's not true, you can correct me. But one of the great parts is being able to travel to some place that maybe you never thought that you'd be able to work in a totally new place and to have those experiences so that you can kind of take time for yourself too, to make yourself feel whole. Anne, would you agree with me or?
Oh, 1,000%. I mean, I'm from middle of nowhere, Pennsylvania. I never thought I'd be in sunny California. So it's pretty awesome. Never thought I'd have this opportunity, and to be out here enjoying it and working is pretty awesome.
So kind of on the same topic, Anne, since you have been traveling for a little bit, what are some things you think first-time travelers should know?
Just ask questions. If you are just questioning anything, ask your recruiter. I mean, they're used to it. They know all the ins and outs, and just be super transparent and don't go into something without asking those questions. I had no idea what I was doing, and I probably drove my recruiter nuts when I took my first assignment, but it paid off because I knew a little bit what to expect walking in.
Yeah, definitely. And I don't think, Avena, Russell, do you ever get annoyed by the amount of questions? Never.
Not at all. Not at all. When they don't ask questions, Saundra, that's when I'm concerned. That's when I'm concerned.
Absolutely.
Yeah. So see,
it helps
Anne,
that understanding.
Yeah.
Yeah, but it's like the late night, after hours, they are probably, just ask Erin.
I know. Yes, the late night questions we'll definitely get to. Just don't expect it maybe at midnight, maybe at, 7 a.m. We'll get back to it. We want to hear all those questions. And I love that you're talking about that because it is such a part of being able to care for yourself in a way that you can make yourself feel like mentally, I'm ready for this change. I'm ready for what's going to come. And I have a little bit of an expectation or an understanding on what's going to be there waiting for me on the other end. I think with that, asking questions for sure, with the recruiters being able to answer a lot. But I think, Avena, you're going to talk a little bit about all of the other pieces that maybe our clinicians don't ask, but maybe are good questions to ask. Like, what about all of the benefits I got as a perm nurse? What happens to those? Oh, and Avena's having a little trouble coming off of mute.
I'm sorry. It's a lot of stuff in front of me. So anyway, definitely, Sandra. I mean, there are so many benefits as a travel nurse that a lot of travelers don't know. You have a lot of the same benefits as a staff nurse. You have health, dental, vision, 401k, you have perks, you have benefits. There is EAP benefits, counseling sessions that you're able to utilize. There's so much that we have to offer. You know, you're able to stay employed 100%. It's like it's 100% we're your employer, 100%.
Yeah. And I think it's good for our clinicians to hear that, or potential travelers, is just being able to have that comfortability of knowing that you're going to have that support in every aspect. We're going to come back to those counseling sessions too, because that is such a big part of what we want to talk about here with that self-care, and normalizing that conversation for all of our clinicians, really for all of us in general, being able to ask for help, know where to ask for help and how to get there. Just a reminder for all my listeners, I do still have a giveaway. So our panel would love to answer your questions. Looking for my first 5 questions in the chat here. Don't be shy. We want to hear from you. We are here for you. So throw those in there. And I think I'll kind of come over to you to talk a little bit about that, just additional benefits piece, and specifically the clinical team, because I know that there's, maybe been times where you've had that support, and maybe you didn't feel comfortable in your perm assignment. I know you were talking about a story just a little earlier on how you get that support in a different way.
Like, I never thought traveling would feel this secure. And to be honest, I never really think of myself as a temporary worker, because I do have AMN behind me, supporting me, and always having that open communication with looking for the next job. And it's kind of crazy because people think traveling is, oh, you got to do it last minute. You just have to get your assignment like 2 weeks before. But, you have the opportunity, if you like that, if you like to work like that, do it that way. But, I'm already set till December. So, it feels, I feel very, very secure in what a lot of people look at as a temporary job. I mean, I contribute to my 401k, I have wonderful health benefits. I feel fully backed and fully supported, sometimes even more than what I did when I had a permanent job.
Amazing. And I love hearing that level of support. I think it's important for people to know. I would be a little crazy if I was planning my assignment 2 weeks out, but
I have friends that do that.
I'm sure Avena and Russell are like, no, we got to get you sooner than that. I think the credentialing piece alone would be like,
oh yeah,
a little bit of time. But we can do it, right? And I think that's the great part of continuing to travel. So for you, Anne, you're already in those winter orders. You've already got it set. But just having that continuous kind of support and being able to bounce from one section to another. I love it. Russell, I would love to hear a little bit from you just on that additional kind of support pieces. So Anne talked a little bit about the 401k, but we also provide things like financial planning, pet care, child care. We'll help you find all of those services in your area. But Russell, anything you would add to that?
Absolutely. Yeah, to talk about what you're saying as far as financial planning. I mean, nurses have seen an increase as far as their rates and over the course of the years, and it's been great to hear. It's been great points to talk about, but what not better way to get ahead and do that financial planning? A lot of us have kids. A lot of us need daycare. We all know that's through the roof. Utilize our benefits to take advantage of those perks. We also have company perks, discount codes for traveling, hotels, car rentals, and those types of things. So it's all there. Just ask your recruiter. But there is a clinical team that's here to support you and to go off of what self-care means. It's putting yourself first as well. We're here to help you and your community with, our clinical team. At one point, they were, a team of nurses. So they've been in your shoes. They've done these travel assignments, and to get that experience, to talk about being vulnerable. It's okay to be that way. I'm not an emotional person by any means, but I will get most comfortable with my travelers. I want to understand you. Do you have kids? What's the reason for not being able to travel that far? Do we need any type of employee assistant programs for counseling sessions? to me, those are things that help us grow and help us grow internally. So therefore we can go out and externally help others.
Yeah, I love that. And I love that you're talking about those pieces. One of the questions we did get before we started from the community, and I'm going to come to you. Will I be considered less of a nurse from the hospital or staffing agency, possibly even my peers, for seeking mental health services?
No. I mean, I don't think that at all. I think all of us, especially in the healthcare field, have dealt with mental health issues either recently in the past. And I think it's very important to talk about that. And I think more and more nurses, staff nurses, your managers are transparent and want you to talk about it, because that's what, keeps you there. And that's what just helps you get through the workday a lot easier. And I feel that being upfront about it in the beginning actually gains you a lot more respect than just keeping it in.
Yeah. And I think I could be speaking totally out of turn, but I think for a lot of nurses, it feels like, well, if I am not there, then who's going to take care of, this person or my patient that I'm supposed to be taking care of? And I don't want to let the team down. So I want to put myself kind of on the back burner. And I feel like that probably happens a lot with our nurses, is I'm going to put myself on the back burner because it's not as important as the other person that I need to take care of.
I'm totally guilty of that. That's, I love nursing because I like taking care of other people. And I do tend to forget about myself. But, as I get older, I'm very aware of my own feelings and my own ability. And if we don't handle our own issues, like before we care for others, it's not going to go well. And, we really can't give someone else all of us if we're not giving ourselves the love and support that we need.
Yeah, giving yourself anything, right?
Yeah.
And Avena, I see you nodding your head over there, my friend. Go ahead and add in.
Absolutely. I had to clap my hands when she said that last piece. It's almost like pouring into an empty cup. You cannot do that. We pour so much into other people, and we're not being poured back into. And as I'm a nurturer, so that's why I kind of put myself into that same category as nurses, because they take care of other people. That's what I do all the time. And so you have to have that healthy balance. And so in order to be able to have that, you have to make sure that you're pouring into yourself first before you're able to actually effectively pour into somebody else. Because if you don't do that, you're going to burn out. And burnout it's real. So definitely get the help and support you need. Nobody is going to look at you crazy.
Nobody here at all. And we all know just the hard work. I mean, we started this conversation just saying thank you. It all comes straight from our hearts of knowing the hard work that you put in every single day, whether you were a specialty that was impacted directly by COVID or just afterwards, or now seeing an increase in patient load. So we just appreciate so much everything that you do. And with that, a big part of the self-care is being able to provide you opportunities to get help for yourself, to have the employee assistance program that Avena, I'll have you talk about in just a little bit, but to have that employee assistance program where you can have counseling sessions for whatever it is that you need, and take the time that you need in between assignments. But maybe Avena, if you want to hit a little bit on that EAP and what it is and what the importance of it is for our clinicians, that'd be awesome.
Absolutely. I mean, it's along the same lines of what we're talking about right now, getting the help that we need. With the employee assistance program, it is, the first piece is, the counseling sessions that you're able to utilize. I believe there's 5 free sessions that you're able to use. I've used them, and I encourage my nurses to use them as well. I've had conversations with nurses where you can hear they're burnt out. You can hear they're tired. They're away from family. They're away from friends, people that love them, people that they know. And being in situations such as that, it can become burdensome. And if they're burdened and they're weighed down, they need somebody to talk to. And of course, they can talk to you, but sometimes it needs needs to go a little bit deeper than that. So being able to have those benefits is amazing. But then there's other pieces to that EAP as well. It's not only the counseling, but if you're going through a divorce, if you need talk with legal, if you need talk with, finances, childcare, like Russell mentioned earlier, there's so many different pieces to it and so many things that we have to offer that you're able to take advantage of. And I push my nurses all the time, take advantage of the benefits that are at your fingertips.
I love that. And yes, absolutely. We want you to take advantage of it. We want you to feel like you're being cared for. So a couple comments in the section. So thank you, Steve. I'm glad that this is helpful information. We are here for you. So ask us a question if you have one too. But nurses care for others, but often forget to care for themselves, which we're definitely seeing more of. We'll get back to some of the questions that we had prior to our session here. But I want to kind of have a little fun here and bring us someplace a little bit different. Anne talked a little bit about all of the questions that she asked her recruiter, one of our amazing recruiters, Erin. But I love that. One of her pieces, right, is being able to have that person that you can really connect with and talk to, and have answer your questions. There's even more I feel like that your recruiters do for you. And maybe Erin did this for you, maybe she didn't. But Avena, I know you were going to talk to us a little bit about connections that you help your clinicians make, because some of the maybe fear of traveling was that you're going to go someplace totally new, totally different. You're not going to know anybody. What do I do, right?
Exactly. I mean, one of the first things that you hear, well, for me, is I want to stay local. I want to be home, especially for the first assignment. 9 times out of 10, that's what I get. And it's because of the fear of stepping out into the unknown. And we have that. I mean, that's normal to be able to feel that way. But the more you support them, the more you push them, the more they trust you, and the more they're able to kind of walk out on that limb and do a little bit more. Just a way that I have connected my travelers. I had quite a few travelers at one facility in one specific area that I knew very well. And so because I had so many travelers there, I was talking to one of my travelers that morning, and she was like, oh, I haven't done anything. I just kind of stay in my room and I haven't went anywhere. And I was like, well, would you like to connect with somebody? I have a lot of nurses at the same hospital. She was like, that would be nice. So I sent out an email to all of my nurses that were there. I asked them, I said, would you guys like to connect? If so, let me know. And I'm going to put you in an email chain. I had about 10 nurses. They were all, yes, sign me up, sign me up. I emailed all of them and I said, here you guys go, loop me out. You guys are able to connect in whatever way works for you. And they did just that and created some friendships along the way. I seen some Instagram posts of, a day trip to Pismo Beach, hiking at Yosemite, things like that. So just being able to kind of hear what they're saying or maybe what they're not saying and being able to connect them together, I think that's a huge piece of it.
I love that. And I know, Anne, I'll come to you next because I know we've talked about this a little bit. But part of that, the fun we've talked about, right? The fun of being able to travel, go someplace new, someplace you didn't expect to be, where you can experience all these wonderful things. But Anne, I know for you, that's kind of part of your self-care ritual too, is being able to go to the beach or do something like that. Talk to me a little bit about what that means for you.
Well, I just want to kind of circle back. I never thought of this, but with my recruiter, Erin, she actually used me to kind of help one of her new travel nurses. Like I actually got him to live with a friend of mine in San Diego when he first came out here, which I think is pretty cool. And I never really realized that I kind of was that person to help him connect. So sorry to kind of go off track, but I'm like, oh my gosh, like I kind of helped someone. So I think that's pretty cool. And I got to meet up with him and that I just all of a sudden just felt special for a second.
You are totally special. So you didn't feel that way already. I'm glad you do now.
But going back to your question, like I'm from middle of nowhere, Pennsylvania, moved to San Diego first assignment. So I'm not a local first traveler. I probably went as far away as I could, but just getting a brighter, sunny place to live. I was in a really dark place back home. That's kind of why I decided to travel. I needed to get away from a really depressing time in my life. And I went to sunny San Diego. So it was great. And, you know, just being at the beach and meeting carefree people on my time off is really what healed me mentally. So, you know, you don't realize it in the moment, but looking back, it really changed my life. So that's pretty cool.
Well, and I know you talked to us a little bit too about a particular experience just back home, and you needed to feel supported in a different way too. And I don't know if you want to talk about that at this point, but just coming out of that type of a situation and then being able to be transparent on this side is part of that feeling.
Yeah, I mean, you know, moving over 3,000 miles away, you hope you leave your baggage behind. But unfortunately, I did have, you know, a very difficult relationship that getting out of, I kind of had to deal with a legal situation. I don't feel, even at this point, I was in the wrong, but I kind of just did it to get out of what I needed to get out of. And I kind of like forgot about it until I had an assignment where it actually came up and I didn't get it. And it was really hard. Like I was in tears on the phone with my recruiter, and before the end of that conversation, we had submitted me and I had a job. So, you know, it's real. Like we're not perfect. You know, I'm like shaking right now just thinking about what I had to go through, but I'm on the other side of it. And there are times that you know, have to deal with your past, but the support that I got was beyond what I expected. So
And I love hearing that. And thank you for sharing that just with the community and having everybody here. You know, we know that you're all people, that we all go through different parts and experiences and pieces of our life. And while your recruiter doesn't need to know every single detail, we do want to be here to help support you through whatever getting you over it or to the next piece or kind of at the other end, to use your phrasing, and what that looks like. And so much of that is a part of your mental health, of you feeling like you're in a good space. We need you. Our facilities need you. Our clients need you. And we want you to feel like we've got your back so that you can support and help patients across the country, right? So thank you for sharing that, Anne. I think it's awesome for this team to hear just all of the ways that we can help you and continue to support you.
Yeah, and I just want to add to that. Sometimes talking about it, I get a little flustered, but you know, it's just, I felt like a bad person. Like when that came up, I felt like a bad person, and like, I'm not, but like you forget that when something like that comes up. And I was, by the end of the conversation and the support that I received from AMN, like it was able to get me out of that dark place that I got to really quickly. So, you know, just because we've dealt with things in our past and they unfortunately sometimes follow us, it doesn't define who I am. And I refuse to let that define who I am. So
not at all. Not at all. And Anne, I think you said it, but you're a NICU nurse, and I just can't, I don't even know how you do that, but I'm so appreciative and so thankful.
I love them.
I know. And I love that because there's no way that I would have the strength to be able to be in that kind of an environment constantly. So you see both Avena and Russell nodding. By no means are you a bad person, but we want to help you get through that. And I think that goes, part of you sharing that, right, is for all of our listeners and viewers to hear. We know that you're people. You go through things. We all go through things. There's things that follow us from our past. There's things that maybe we feel a little guilty about, but we want to make sure that you get to the other end of it and help you get to the place where you're helping support patients and really caring for others, but it starts with you. Russell, I'll come to you a little bit too, just to talk about, I know you had some kind of stories along the same lines as Avena, where you're connecting your clinicians so that they can have those bright moments, to Anne's point, where they're getting that self-care. And maybe that's with other people. Maybe that's just even telling them things that they can do, right?
Yes, absolutely. And for starters, you got to back up a little bit and address kind of what you said. I love it. I can resonate to the moon and back with, you know, situations and past and things that we do. And as you circle that and you couple it all together, it brings it back to taking care of yourself and putting yourself forward. But the positive note was that you came out on top. You had a job before the call was ended, and it was snaps all the way around, you know, so congrats on that.
Thank you.
Of course, it kind of hit home with me, but I mean, to what Saundra is saying, it's the connection between you and your traveler, you and your recruiter, and again, identifying what it is that you're looking for outside of an assignment, and what the expectations are, and what you want, and it does take some of these conversations. It does take some of these things because it makes you feel heard. It makes you feel like we're taking action on things that we're looking for. So take time out for yourself. Go on those Yosemite hikes. Go do those boating trips. Make a memory, make an experience, and you look back and you say, "Yeah, I did that." It creates an amazing experience and the beauty of travel. So. Um, I resonate with your story and kind of what we're doing. I'm still riding that high, by the way.
Everybody's
Really
gonna
sent
feel
home with
amazing
me.
after this
We all
call.
got a pass. We all got a pass. We've all got something going on. That one hit home though. So kudos and snaps to you.
Thank you so much.
I love it. But I mean, that's true. And one of the things that I love being able to do, and if you're not following us already, just follow at AMN Nurse so you can see what all of our clinicians are doing on their assignments. Picturesque, amazing places. And Anne, I'm sure you can send us all your pictures. I've seen a lot of your pictures and you got your move down, which I love. But it's so cool to see. Yes. It's so cool to see all of the places that you're able to travel, all the experiences that you have. I know for me, and I could probably get self-care from all of you, but for me, just even being able to sit by myself and go someplace new and read a book and just take that little bit of time for myself fills my cup back up, to Avena's point. So make sure you're having those experiences and get back to traveling just because it's so fun to be someplace else. But I see Anne nodding her head. So I know she has all kinds of fun stories. And I'm actually going to talk a little bit about something that you said earlier. So while Erin may not be able to answer your questions in the middle of the night, we do have our amazing Passport app that can help with so many of the questions and things that you need. It's really awesome because the Passport app does allow you to have that connection between self-service and being able to do a lot yourself, but also that human element when it comes to our recruiters. And Anne, I see you nodding your head. So are you using the Passport app?
Oh,
What do you use it for?
Yeah, I use the Passport actually all the time. I used to get on the webpage and now I'm like, well, it's too much. I'm just going to use the Passport. But it is helpful. Like a lot of the forms that I would have to call in the past about to find out what to do, it's right there on the Passport. You submit it. It's so easy. Like I'm impressed. And it seems like there's always updates and always improvements with it. So it's just making it easier and easier. And I love that when you first log on, you see potential jobs at the bottom. So I'm always scrolling, even like if I have my plan, I'm always like looking to see like what's out there. So I love the Passport. I actually think it's one of the best things, that you guys have done since I started. Because when I started, you really didn't have, I don't even know if it was a thing then.
Not even a thing, Anne.
Yeah. So I use it all the time. I submit my time on there. I submit all my forms. Like it's made this a lot easier.
I love it. And just a teaser for you, and I guess for the entire community. So get on Passport. There's going to be even more fun stuff coming. Some ways to give you experiences for using the app. So some cool stuff. So make sure you continue to use it. Be one of those top users. But yeah, we want to, along the same lines, right, of that self-care piece of just that 24/7 support. And Russell, I'm going to come to you in a second too. We want to give you those opportunities to really have fun and have experiences. So, and be on the lookout. Russell, would love to hear from you. How do you have your clinicians or your candidates use their Passport app?
Just talking about it with a few of them yesterday and this morning, utilizing the app, 24/7 service, like Saundra was saying, at any time and point, you're looking for a position, your recruiter's working with 30 to 50 different 30 to 50 different travelers. They've got their thing going on, but they're like, hey, Anne, we're working for you. We're going to make sure we find something for you. If you're sitting at, in a lobby and you're waiting to do something, hop on the app and take a look to see if there's an open position. If you've got a position you finished and you got a question about credentialing, jump on there, take a look to see what documents are outstanding. You submitted your medical documents, but you've got some quizzes or you've got some modules that you need to do. We all know how fun those are. Make sure to knock those out. It's fast, it's efficient, and it's your one-stop shop when it comes to everything you need to know about travel. And feel free to jot any questions down, and you can always ping your recruiter.
Yeah, I love that. And Avena, I know you have something to say here about the recruiter piece, but we love having our clinicians have the opportunity. We know a lot of times you're on a night shift and your break comes at midnight, and that's when you have 15 minutes to really sit down and think about, well, maybe where do I want to go for my next assignment? So being able to jump in, and sounds like you did that, look and see what's out there. Let me just shop around a little bit. But Avena, I know you have a favorite portion of the app too, so I'm going to toss it to you.
Yeah, definitely. My favorite portion of it is, for me, set me as your favorite recruiter. I tell all of my nurses, set me as your fave, right? If we're faves. So set me as your fave, and I get all of your jobs, everything you're looking for. I'm able to know what it is. And so we're able to work together to find you that great opportunity. So if you're doing it at night, I come in the morning, I see the jobs that you're interested in, call you about them, get you submitted, and we're able to work together quickly to find you a job. Because like Russell said, we're working with a lot of nurses here. And so when nurses take, a little bit of leadway in helping find them a job, we can find them the perfect location.
And it's just so fun to be able to search a little bit differently. And yes, your recruiters will ask you to set them as their fave because you can't. That will give all of your activity to them, which is great. When we're in the office, maybe you're sleeping from that night shift, or maybe you don't have a minute, but we can communicate a lot through that. And all those credentialing pieces I saw Anne nodding furiously, just being able to go in there and complete so much of that is huge. We want to make it easy for you. We want doing business with us to be easy and just make it simple and efficient. So definitely jump in the Passport app. Well, I am going to jump us away to answer a couple more questions that we got prior to. Still looking for questions in the chat, so feel free to throw those in there. Would love to hear from you and just some of the things that you want to hear from us. We're here for you. I do have another giveaway since we are self-care summer. Would love for you to follow. So if you're not following already, jump on Instagram and follow at AMN Nurse. So AMN Nurse. And then go ahead and like our post, like and comment our post today. It looks like it's on balancing a busy nursing career while maintaining your mental health and well-being. We'd love to hear your self-care routines. If you jump on there, we do have a mini camera and a backpack cooler. So I know Anne's like really excited about the giveaways. So perfect for summer and for capturing all of those amazing moments. And then once you do capture those, don't forget to tag us at AMN Nurse so that we can see what you're up to. We love to see what our clinicians are doing out there. It lets us live vicariously through you while we're stuck in our offices or in the actual office, since we have gone back a little bit. So let us live through you. I got a question, and maybe I'll start with you, and then I'll give it to the rest of the panel here. How much time, so I'll maybe answer this piece, but how much time is it okay to take off when I need a break? I don't want to quit nursing, but right now I don't feel like I can do it anymore. So maybe from you, Anne, what's some advice when you're feeling this way? What are some things that you do to kind of get yourself a little bit in maybe a better mindset?
I do plan to take time off, especially in the summer. Like my birthday is in August, so I try to plan to go back home and spend some time with my family and my friends. It's very important to me. It kind of resets me, and I'm able to take that break away. And you're probably better to answer that question, but I think it's like 21 days or something, so I don't lose my health insurance. And that's important for me. But 21 days is a long time. So, you're able to go home and reset and have a fun vacation without worrying about, the consequences of not working.
Totally. And I think, Russ, I'll come to you. I saw you put your thumbs up. So you are right. It is 21 days. So I think that's such an awesome part of travel nursing. I don't get 21 days in a row that I can take off. That's a long time. But you set that next assignment so that you know where you're going to be headed once that 21-day time period is off, or less if you don't want to take that much time. But it does give you a really good break just to recenter, to get to a place where you feel really good. Maybe travel to some place that is far away. So, we talk about traveling within the United States to work, but take those 3 weeks and go travel to Europe if that's been your bucket list, right? So Russell, you want to follow up with what you do with your nurses there, the 21-day break?
Yeah. So in between contracts, it's great hard reset. I need to take some time off. We hear it, we understand it, we value it. What it comes down to, like we've kind of talked about, is self-care. Go home and go see Aunt Susie. Go home and take care of those babies. Go home and do what's right for you at the time being. Hey, if you needed a vacation from a vacation assignment, go take it. Well deserved. Keep in mind, anytime we book a placement out, it can be within, 3 to 4 weeks out. So, if you're taking 2 weeks off and you got to rebook for another 3 weeks out, you've got 5 weeks to go play and kind of, get situated and get back with your day-to-day activities. But that is, again, bringing it all home to the beauty of travel is the flexibility and being able to have the autonomy to set your schedule to make it work for you, when you want, how you want. Of course, there are a few guidelines, but for the most part, putting yourself first and foremost. We value that. We love it. And just keep that communication with your recruiter, and the recruiter will definitely do the same.
Definitely. Avena, anything to add there?
No, just basically piggybacking off of what Russell said. It's important for them to be able to take time off. I have several nurses that have small children, and they'll go take an assignment away from their child. And so it's really important that they still are connecting with family, and take the time that you need to, go and do that. That's really important. And I encourage it.
Totally. Yes. Take the time off. And I can't wait to hear about your trip over your birthday and all of that good stuff. It'll be fun to see. We did get a couple of questions in the chat. So one was, how do I start an assignment? And I think I can probably answer this. The biggest thing is just to call your recruiter. They'll go through every single step with you. It's one of the great things about traveling with us is that you have a partner, as Anne was talking about. And you heard Russell say it too. We just love to know who you are, what's important to you, what will make a travel assignment really great for you. So just call your recruiter. That's the kind of first step there. And then we did get one from Katie on what are 3 tips you might give a first-time traveler to make their online profile attractive so that they can be picked for an assignment. And any tips that you would give for a first-time traveler?
Like really brag about yourself. So if you've taken that time to get a certification in a specialty, put that on there. I have my RNC in neonatal nursing. So that's something that sometimes I forget that I have, but putting that on your profile is like, okay, like this person is really dedicated to that specialty. So just, brag about yourself, show your hard work that you've put in, and just blast it.
I love it. Sometimes a hard thing for nurses to do as well is to brag about themselves, but 100% talk about all those things. Avena, anything that you would add to that?
I would say be honest, about your skills. Put them out there. Don't I've had nurses on both ends of the spectrum that just basically exaggerated to the point where it was almost unbelievable, with the skill set they had. And then I've had nurses that did not, put all of the experience that they had because they were like, well, I don't really, want to toot my own horn, but toot your own horn. I think that's really important for you to be able to do that if you're being honest while you're tooting it, like beep, beep, okay? It's really important for you to be able to do that. Let us know what you have to offer, the skills that you have. That's super important.
I love that. Russell, any other tips that you might give to make their profile look amazing?
Just to kind of go back to what Ann and Avena are saying, I mean, it's put your certifications down, Talk about the years of experience. If you've got a superior reference or you've got something that's really standing out, put that on there. Again, it's all about that communication piece. Toot toot beep beep to what Avena was saying. Toot the skills. Yeah, absolutely.
I love it. So biggest piece of advice, it sounds like, is just tell us, let us know all the amazing things that you've done. Don't be afraid. We're not gonna look at it as you tooting your horn too much. We love to hear it. So we know that you're all so special and so incredible. So let us know about it. All right. Well, I know we're getting close to the end of our time, which is crazy how quickly this goes by. I always love these conversations. We're gonna have a little fun with our recruiters and maybe open up our clinician or traveler's eyes to some of the things that our recruiters can help you with. But a big part of what we hear from this community is that one of the big reasons that you travel or you go to a different place is so that you can impact a community and make a difference there. We hear all the time about units potentially closing if we don't get OR nurses there, or if we don't get ICU nurses or NICU nurses or whoever it might be. So our big drive to get you to different locations is to help with that community. But Russell, I'm going to come to you first because I know you had a fun story about one of your travelers who ended up in a totally different place than they expected.
Yes, we had a traveler who I got in contact with. We kicked it off great. We built rapport, and we were talking about going to Boston. She's originally from Texas, and it was great time. It was starting to become, starting to warm up around the April, May, June time. And she says, "I've heard it's beautiful there. Let's take a trip." And everything sounded perfect. We got a phone call after we booked the assignment about 2 days later, and they said, unfortunately, due to the census, we're going to have to cancel the assignment. Those are things that happen. As you can tell, Anne, I'm just based on the facial expression. It's like, oh my gosh, what's going on? You turn and pivot. You work tight with your recruiter and you make it happen. Based on a dollar amount, based on a exclusive contract with AMN, we were able to get her an assignment effective immediately. Where this destination was, we went from original home place of Texas. We got her to Boston. We unfortunately had to cancel due to low census. We brought her to Omaha, Nebraska. And you're probably wondering how, why, and where did we get there? She said she doesn't mind big cities or smaller cities. She said she's never been, but she's a true traveler. She wants to find out top destinations in all locations. We got her on an assignment. She found a church that she attends on Sundays that was in walking distance from her apartment that she was leasing. On the way home from that church event, she was able to grab a brunch. Brunch was serving unlimited mimosas and, your sparkling drinks and cute, quiet town. It was beautiful, just people around. And she says, I have never had this kind of fun and experience based on the differentiators that we were looking at. So all in all, it was a success financially, mentally, emotionally. And she says, never would I have I ever. So thank you.
I love that, Russell. And you see Anne kind of laughing over there, but that little bit of flexibility, we will put you where the need is if you're a little bit flexible, and you just never know the type of experience that you're going to have. And it may not be something that you ever expected. But you may end up loving it. And I know, Avena, you have a kind of similar story of one of your favorite places.
Yeah. I think being flexible is super important, and you have to push nurses outside of their comfort zone, and that's the conversation that I have with them every day. And so sometimes you mention a destination and they're like, what, where? Like they are not interested in one of these locations. I remember, like it was yesterday, Bangor, Maine. I used to send nurses there all the time, but there were a lot of nurses that would be very resistant to that location, just because it's Bangor. Like what's in Bangor? Like what's in Maine? But she was very hesitant. She didn't want to go. I was able to sell her on the location, sell her on the hospital. Once she got there, she was like, oh my gosh, the hospital is so traveler friendly. I really love it. They work with my schedule. I'm able to take blocks of time off where I can go home and, be with my family and come back. I'm able to see the beautiful scenery, eat some amazing food, walk along the greenery and the water. And, she was telling me like so many things about it that I was able to tell my other nurses about that location. But not only did she stay for that one contract, but she extended through the winter in Bangor, Maine. Like, yeah, no, that's what she did because, so you have to talk them, off the ledge and get out of their comfort zone. Be flexible. You will find a position that you love and you'll want to stay.
Yeah, I love that. And you kind of have to have that trust with your recruiter a little bit. We may sound a little crazy when we're telling you about Bangor, Maine or Omaha, Nebraska, but based on what you're telling us, if if money is really important, or if you want that resume building experience, or maybe it's just that you want to be in kind of an area of the country that you've never been to before, we'll remember that and we'll help you get to where you want to be, and might be a little out there, but you never know the experience that you're going to have. So I don't know that I would stay in Bangor, Maine through the winter, but I love it. Anne's nodding her head. She's like, no, sunny California, please. So we're definitely here to just help you maybe look at places that you've never considered or never thought of before. But Anne, I know you're staying out this way a little bit.
Oh, yes, I can't leave. It's so sad and depressing out here.
And we did get some more questions. So I am going to wrap this up here in just a little bit, but I did want to get through some of these additional questions that we have gotten. What can I do when I'm so burnt out during an assignment, but I can't cancel mid-contract, which we appreciate. We know that you're there to help support the facility, help support the patients. So what do you do? I feel like I just really need that time off. And I know you were just recently talking about what you did in this type of a scenario.
Yeah, I got burnt out just a couple of months ago, and I had a real conversation with the manager, and I was like, I can't do this. Like I need some time. And just, I think the transparency of just being honest about how I was feeling. There was like this crazy event that happened at the hospital that, was unforeseen when I started. So, I was just like, I need time off, and they worked with me. I mean, it was to the point that they were like, okay, this is just like a scheduled time off for you. No big deal. So you just have to ask for it. And, if you're honest and you're telling them why you need the time off, we're all healthcare providers at the end of the day. So we understand mental health is health. So, you need to honor that. And they did. So I just had a quick little reset and got right back to it.
And I love what you just said there. Mental health is health. We're all healthcare providers at the end of the day. That's such a big message, I think, for all of our listeners to hear and all of our viewers to hear. It's part of your health. Just like you would take time off if you're feeling sick, take time off if you're feeling like you're just mentally not there. We want you to provide the best patient care. Your patients want that from you. They want you to take that time that you need. So just being transparent, letting us know how you're feeling, letting the facility know how you're feeling. We're here to support you. Katie asked just what makes AMN the best choice as my agency. So many things that we've talked about, but maybe my number one thing would just be the support. And what would you say?
The support, the relationships that, I've built with this experience, and my recruiter just, you guys are real people, and that's just refreshing to be able to have the real conversations and to have them have a real conversation back with me. You can't, my permanent job, I didn't have relationships like that. So that's why I love you guys.
I love the relationship piece. And one of the big things that we want all of our viewers, listeners to get from this is just that your recruiter is a real person. They're here for you. You heard Avena talk about just, weekly calls that she has with her nurses just to check in and see what you're doing. We care about you. We don't want to just put you out there and have you flounder. We want to support you and make sure that you're feeling like you're in a good spot and you're getting what it is that you need from that travel assignment, whether it's just that adventure piece, maybe it's just getting a change of scenery so that you can feel like yourself, a little bit more whole. I love all of that. All right. So kind of just following it out here and wrapping it up. We've got 5 minutes, which is crazy. I would love to hear from all of you. Maybe what's one of your bucket list items or things that you want to do? Russell, I'll start with you on what's one of the bucket list things, maybe a place that you'd like to travel to?
So I'm here in San Diego, born and raised in the Bay Area. I've done a few traveling outside of, the States and so forth, but if we're staying inside the States, I've always wanted to check out more of the East Coast. I would say, there's been places in New York that I've gone. No offense to anybody that lives there, but it's not for me. But I've always wanted to check out, different cities and different states. And I'm a foodie. I love trying foods. I love going out and experiencing things and just there's so much to life outside of our day-to-day grind, our day-to-day hustle and kids, school, work, extracurricular activities, and we get caught up in that rat race. But when we're able to separate ourselves and say, you know what, where is it that I want to go?
Yeah.
I would love to go back. I mean, I want to check out Boston. I know I talked about it, but the people alone. I want to hear like a fly on the wall and hear the conversations. Like it's got to be remarkable, check out ball stadiums. I've checked out a few different stadiums in different states, but I've always wanted to go to Boston in the summer.
I love it. Avena, what about you?
So I know a lot of the times when people think about travel, they want to step outside of the States. But, I was talking to my sister the other day and I was just looking at landmarks in different places. And I said, what I would love to do is just travel to every state in the United States. Like just go. There's so many places that I haven't been, so many things that I haven't seen, just because I don't know why. And so, we'll go to Mexico quickly or, wherever, but let's just travel throughout the states. And so that's something that I'm trying to start and just kind of check it off, state by state.
You need one of those maps that you can scratch off the state as you go to them, right? Yeah. And what about you? Bucket list?
Yacht Week, Ibiza.
Yes.
That's all I have to say. I love boating. Yeah, that's where I want to go. One of my actual travel friends did Yacht Week. I don't know where she went, but it just really lit a fire, and that's where I want to go. That's what I go.
Love it. You're going to take those 3 weeks off that you have in between, travel to Ibiza, be there for Yacht Week, have a great time. Tag us at AMN Nurse so we can see all the fun that you're having. I love it. Well, I just love hearing from all of you. We did get a question for you, Anne. Would love to hear if you have ideas for team events that focus on well-being with your colleagues in the facilities that you travel to. So is there anything that we can do to help you feel more connected from a well-being standpoint? Maybe it's a yoga class or something like that.
I think it would actually be really cool to maybe be connected with the other AMN nurses. Like you walk in there and you're always asking the travelers, what agency are you with? What agency are you with? So it might be kind of cool to just, before you get there be some sort of platform, whatever it may be, that you can connect with them. And yeah, just even just going, I mean, I'm up in the Bay Area right now. I would love to do a sail around, the Bay and just make that a little retreat, that would be fun. I know there's platforms out there that do that, but I think that could be something that AMN could kind of specialize in.
I love it. Kim Martini, hopefully you're taking note of that. So I love it. We do have a lot of travelers, especially in the Bay Area. There's so many great hospitals up there that we work exclusively with. So I love the feedback. Well, thank you again, Gypsy community, for having us. Rachel, everybody at Gypsy Nurse, we love being a part of this. So thank you for inviting us back. Thank you to my panel. They're amazing. But yeah, just thank you all around to everyone.
Yes, thank you so much. And if you're tuning in late, you can always watch this on demand too and reach out to AMN. They'll be happy to help you. So thank you, everybody, and have a great week.
I love it. Thanks, guys.
Bye. Thank you.
Thank you.
Take care, everybody.
Bye.
Bye.